Please excuse that abrupt interruption. For some reason, my computer just shut down and restart. So I'm just going to pick up from where I was. I was talking about the bones that were in the hands that are called phalanges, and we have a total of 14. If you ever get confused, you can do your hand like this, and you can count each one. So there's 3, 6, 9, 12, 13, and 14. So 14 phalanges in each hand. Same thing with the toes. The toes and the fingers are referred to as phalanges. Okay, so as I was indicating in regard to the pectoral girdle attaching the upper extremities to the torso or to the axial skeleton, then we also have what's referred to as the pelvic girdle. The pelvic girdle is responsible for attaching the lower extremities to the axial skeleton. And so we think of the pelvic bones, and when we look at the pelvic bones, they actually look like one bone, but they're two, and they are called the os coxa. The os coxa has a few anatomical structures that we need to know, and they kind of look like elephant ears a little bit, but they have a portion at the top that kind of looks like the top of an elephant ear that's called the ilium. The lower portion of that bone is referred to as the ischium, and the anterior region that meets with the other anterior region of the other os coxa is called the pubis. So the three regions of the os coxa include the ilium, the ischium, lower L shaped, and the anterior portion, which is called the pubis. Now, on the os coxa, we have what's referred to as the acetabulum. The acetabulum is a concave shell where the head of the femur actually rests. So this allows for that ball and socket joint, so to speak, so that we can have full rotation. And we also have obturator foramen. So that word again, foramen, is indicating a hole. And that's the very large hole that you'll find in between the anterior and the lower region of the os coxa. So the os coxa is fused together in the middle with the other os coxa by that fibrocartilage. Remember, we call that the pubic symphysis when we were talking about tissues. It's made of fibrocartilage, very dense connective tissue. All right, then we just go down the leg. As I indicated before, the largest and the longest bone in the body is the femur. And then suspended within tendon is the patella, which we also call the kneecap, sesamoid or round bone. We have two bones of the lower leg. The most medial of the two and the largest of the two is called the tibia. Sometimes we refer to it as our shin bone. And the smaller lateral bone is called the fibula. Both of these bones, at the distal portions of them, have two anatomical structures that are worth noting. The medial malleolus is located on the tibia because it's the most medial bone, and the lateral malleolus is located on the fibula. Well, you might try to say, well, I don't even know where that is. Well, rest assured, if you have ever hit it on the medial, the inside of your ankle, or the lateral outside of your ankle, like with a grocery cart or something like that, you would know exactly where the medial and the lateral malleolus are. So the medial malleolus is kind of that bulge right there at your ankle, and it's the most distal portion of the tibia, while the lateral malleolus is the most distal portion of the fibula that's on the outside of that bulge on the outside of your ankle. And then we get back to what we know, just inferior to the tibia and the fibula, we have the tarsals. Now, all the tarsals have names, but there are only two that you are required to know. That's talus, and talus is the most inferior, well, it's the most superior tarsal, but it's that bone that lies directly inferior to the tibia and the fibula. So it actually articulates with those two bones. And then also calcaneus. Calcaneus is our heel bone. And calcaneus is also the bone that has the Achilles tendon attached to it. And when we start talking about muscles, we'll identify another name. It's referred to as the calcaneal tendon or the Achilles tendon. And since I mentioned tendon, it's worth noting that tendons and ligaments are points of attachment to the skeletal system. Ligaments attach bone to bone, and tendons will attach muscle to bone. When we get to the next chapter on muscles, we'll talk about what's referred to as an aponeurosis, because an aponeurosis is also another type of attachment point, but it attaches muscle to muscle. So ligaments, bone to bone. Tendons attach muscle to bone, and aponeurosis attach muscle to muscle. After we have the tarsals, then the bones that make up the instep or the top of our foot are called the metatarsals, and we have 5 of those, just as we have 5 metacarpals that make up the framework of our hands. And then additionally, finally, we said we have a total of 14 phalanges in the toes. Well, that was all I had left, but for whatever reason, the computer decided it was going to shut down. So make sure that you review the information in preparation for your assessment and have a wonderful week.